Hi, everyone. First off, I would like to thank everyone for taking a little bit of time out of your day to learn more about maximizing remote care management in a COVID-19 world. Real quick introductions. My name is Chase Idleman. I'm the VP of Sales for Connected Health. With us, we also have Michelle Bianco, who is our VP of Operations within Connected Health. As most people on this call are aware, Zimmer Biomet is famous for their implants. A few years back, a strategic decision was made to invest heavily in solutions that move specifically beyond implants. Our mission at Zimmer Biomet is to improve the quality of life and alleviate pain for patients around the world. COVID-19 put us in a really unique place in time. We're in the new frontier of what normal looks like. When you think about the subject matter of disruptive technologies that can truly add value, care management is front and center. Today, we're going to be talking about two products within Connected Health. The first is going to be My Mobility with Apple Watch. The second is going to be Ortho Intel, which is our orthopedic intelligence platform. But before we go into the actual products, we want to take a look at some of the challenges that we face in today's environment. Social distancing has clearly changed the modern era, all the way from getting your hair cut to putting your kids in daycare to seeing your doctor. The community over 65 years of age was especially hit hard, and defining what truly is elective can sometimes feel unfair and sometimes unjust to those that are in suffering. That's where technologies can help step in, but we have to do so in a manner that's thoughtful, uncomplicated, engaging, and elegant. We're not maniacal about two things at Connected Health. First, we're always asking ourselves, what problems are we going to solve with technology? The second question that comes out is, how do we make technology feel personal? And what does personal really mean? Are those patients engaged? Will we be able to create an experience to where the patient unconsciously can grab their phone, as they do so often, whether you're managing Facebook or Instagram, but they can do that with healthcare, where they're unconsciously grabbing that phone and it helps connect them through their experience. And then we have to think about the challenges from the lens and the optics of the executives out there. There was a study late 2019 from Becker's, 70 hospitals asking executives, what were some of the main IT priorities that were around? Patient engagement, data aggregation, analytics, precision medicine, all ranked highest. And that was 2019. That was before COVID-19. You would imagine where those priorities landed now. So we have to address these challenges and priorities head on. Fear, anxiety, they're two words that we often hear, and they can often prevent people from seeking interventional help. I'm going to hand it over to Michelle Bianco, who's going to talk more about how care management can positively impact that experience. Take it away, Michelle.
Thanks, Chase. In a recent JBJS study involving Johns Hopkins, their predictive model demonstrated that when healthcare returns to its pre-pandemic capacity, it will have greater than 1 million surgical cases in its backlog. That number is fascinating, and it's significant to overcome. And the time period for recovery may take longer than anticipated. Many surgeons are turning to ASCs to provide them with a second location to begin to reduce their backlog by readily adding surgical blocks, as well as an environment that reduces patients' fears, as most ASC sites did not experience an influx of COVID cases. The opportunity to promote remote care management at an ASC provides what some may consider a safety net for that patient as they make that transition from inpatient to outpatient care. Let's use an example of total joint or spine patients moving to an ASC. Considering the inpatient stay, there are a significant number of touch points that they receive during a 1 to 2 day hospital stay. Many team members support the patient through the preoperative and postoperative discharge process. Now, as care is transitioned to an outpatient setting, patients are discharged in as few as 6 to 8 hours. And the patient and caregiver can have anxiety as they are discharged home with only a sheet of paper. Adding remote care management to the outpatient setting provides the opportunity to lessen that anxiety for the patient and the caregiver, as they can easily stay connected with their care team. Equally important, we have found, is the increased comfort that remote care management provides to the care team themselves. Through a dashboard, metrics, and text messaging features, clinical insights can be gained into the patient's recovery at home. So while we haven't discussed Zimmer Biomet's platform yet, I want to make sure that can anchor this discussion into the value proposition of remote care management in the orthopedic specialty, specifically for today's environment. An educated patient is more prepared for their surgery, and the intent is to ensure expectations for recovery are set and cancellations may be reduced. Standard of care for orthopedics can be structured as a preoperative joint class, maybe one-on-one education, or even a pamphlet for more minor surgeries. Education can be resource intensive and is typically in a bolus format. Patients can be overwhelmed by that volume of information. By providing time-based, procedure-specific content, education can be provided in small, frequent doses to increase the likelihood of comprehension. So what type of information is typically provided during the pre-op or post-op period? We see education range from clinical reminders to reduce surgical cancellation, complications, and readmissions, to process education that improves home safety and nutrition. And by providing proactive information to the patient, the less likely the patient will be to call the office or the navigator with questions. Well, we have used patient-reported outcome measures for some time now since the inception of CJR. Giving the patient access to PROMs and physiologic metrics isn't as available without digital tools. Providing patients with access to metrics by which they can see progress and have accountability into their recovery can create a shift in that provider and patient conversation. In today's environment, post-op care has been impacted by social distancing. We've heard those stories of patients expressing concern that they are concerned about home care entering into their house, and they don't have easy access into outpatient PT for access to care. So remote care management can provide access to physician-recommended education and video-based exercises from the comfort of the patient's home. And while these patients are social distancing during recovery, they can have access to the care team through a virtual connection, literally at their fingertips through digital care tools. If there's visibility into the patient's recovery, it provides the opportunity for clinicians to select which patients need to come into the office and what opportunity there is for those patients to stay home. And then that allows for the opportunity for the surgeon to maximize their schedule and provide flexibility for the patients. So I'm going to turn it back over to Chase so he can share more about Zimmer Biomet's My Mobility with Apple Watch platform and how it addresses some of these key components in remote care management.
Thanks, Michelle. All right. So what is My Mobility with Apple Watch? At its core, it's a care management system that's handcrafted in the space of orthopedics. We have care plans from total joint replacement, foot and ankle, upper extremity, sports medicine, and we're soon releasing spine as well. This includes education, pre and post-operative videos, as well as messaging. But our punchline often goes back to three things. Those three things are: one, genuine patient engagements. That's what we're aiming for here. Two, we want to reduce the variability of care that we observe out in the community. And three, we want to aim at bringing in data that leads to meaningful clinical insights and clinical decision-making. This is not about selling a technology. This is about being able to differentiate programs. If I'm to break it down to just the 5 core features of what it is, we're going to start off with one, the education. So all of the education that you would normally be able to provide in a joint class that comes in that paper binder, we customize that and put it into a digital framework. 2, patient-reported outcome measures. We're very proud that we have north of 80% compliance rate on those. 3, encrypted messaging, and this includes video as well as text. 4, you see the watch that's up there. We have a very unique relationship with Apple. We have a unique fulfillment model as well. So every patient gets an Apple Watch. And with that, we get very rich data throughout the episode of care. So we get biometrics, but we also get a different way to engage the patients. And this goes back to making it personal. How can we create those experiences in a way that's unique, different, and they feel like they're getting touch points along their episode of care? And the last one on here is self-directed video exercises, as well as prehab, as well as post-operative. Now, we've developed an open API strategy that allows us to add in additional components and plan for the future. This is very meaningful in terms of how we're differentiating ourselves in the market. Let me give you an example of where an API strategy comes into play. Up in front of you, you see a slide that talks about OrthoIntel. That's our orthopedic intelligence platform, where we're able to take out data from our ROSA robotic system, such as soft tissue balancing. This becomes very meaningful because now we have objective data sets, preoperative, intraoperative, as well as postoperative. Now, your mind can start to go wild in terms of where you take this information, where you take this data. But we have the capabilities of aggregating this information, providing comparative analysis. And we're not stopping at just ROSA. We're looking at an entire scope of informatics that we can apply through this API. So I talked briefly about the relationship with partner. It's something, the partnership with Apple, it's something we're very proud of. The core component to it is it's an ongoing participation in a large multi-site clinical study. As I mentioned earlier, every patient that enrolls has an opportunity to get an Apple Watch for use during the entire 120-day episode of care. And the data that we're capturing looks at things such as step count, stair count, as well as standing time. Give you a real world example of the first doctor I ever spoke to when we were talking about my mobility with Apple Watch. For him, he said, well, this is revolutionary because, you know, now I can see what a baseline is for my patients 4 weeks prior to surgery. They go in, have interventional surgery. For him, he feels like he does a great knee. He has a really good outcome potential. But there are still those patients that are dissatisfied. And he said, I can now visually start to see, are those patients not getting out of the couch? Or are they going rock climbing? Are they pushing it too hard at that point in time? Those are all things that are unique and different that we're looking at. Michelle mentioned earlier a little bit about ASCs, and we're in this transition state as well. And clearly that's a huge focus for anyone in the space of orthopedics. I do want to hand it back over to Michelle to talk about how we're approaching it differently at Zimmer Biomet to tackle this paradigm shift. Michelle?
Thanks, Chase. Earlier, I mentioned the JBJS study that talked through the backlog of cases. Several strategies were recommended in this article to support those backlogs during this COVID time period, some of which include increasing the use of telemedicine, increasing block time for orthopedics, and a shift to ASCs with dedicated care coordination resources. And before I dive in specifically as to how my mobility can play a key role into supporting patients in an ASC, I wanted to share that Zimmer Biomet has pulled together a unique offering to support ASCs throughout the episode of care, and its value is underscored in this critical time period. The first solution is efficient care. Zimmer Biomet's efficient care program can help reduce the footprint within the sterile processing department by decreasing to 2 trays and allowing for more timely and consistent preparation for surgery, all while reducing cost. Another valued offering is Accelero's clinical consulting services. These services support programs while they are transitioning to their total joint replacements to an ASC. They put tools and processes in place to create a more predictable experience for the patient and the care team for the episode of care, essentially moving from a surgical event to a programmatic approach to care. For those facilities that already have a strong orthopedic program and they're challenged with meeting the growth demands because of COVID and that backlog, perioperative efficiency experts can create standard workflow processes and scheduling tools to maximize throughput through Accelero's clinical consulting services. These solutions, coupled with our best-in-class products, are available with the contracting capabilities to address today's challenges in ASCs. Now let me get to highlighting how my mobility can support in the ASC setting. As total joints have transitioned to the ASC, coupled with the increased concern of social distancing, my mobility provides that opportunity for patients to receive the self-directed video-based exercise Chase talked about through the My Mobility application, potentially reducing the need for supervised rehabilitation in the right patient. It also reduces the need for a joint education class, as content can be provided up to 30 days in advance of that surgical event. It is important to note that the exercise and education adherence is visible to the care team and the patient. And if a patient needs a nudge for improvement, that can be provided through text messaging features, thus increasing the connectivity with the patient without necessarily increasing visits. It's a critical value proposition in a COVID-19 world. We have heard some of our surgeons emphasizing the value of MyMobility by telling patients that their surgery is at risk of being canceled if they don't maintain a high adherence rate. That emphasizes the value proposition that education has preoperatively, as well as the patient's individual role in not only their preparation, but in their recovery. So let's talk postoperatively about the impact of MyMobility. MyMobility provides education and exercises based on the surgeon's clinical recommendation. Many of the surgeons want their patients to have access to total joint replacement content for up to a year postoperatively, and sports medicine content for 6 months as an example. Self-directed exercises timelines can vary as well, and it can be done independently through the application, can be done in adjunct to a supervised physical therapy program, or as a hybrid model to reduce some of those supervised PT costs. The goal is to support the patient with an optimal outcome. The surgeon and the care team chooses the right path for that patient, and they follow their recovery and compliance through the MyMobility dashboard with objective data. Pictures can be sent at the direction of the care team based on the symptoms or the metric change that they are proactively seeing from the patient. Or the patient can actually send a picture to the patient, to the clinical care team. The overall intent is to provide additional data points to what typically is a subjective phone conversation. And it provides clinical insights unlike what is available in today's standard care. Let me give you an example of how this changes a post-op call to the office that is rather routine. A patient calls in with a concern of knee pain and swelling. That patient may get passed from the front office to the right care team member. Subjective information is gathered as to how that patient perceives this has happened. Now with MyMobility though, the clinical care team has access to step count trends and stair frequency, how often they've gone up and down the steps, for instance, and the patient can really understand, not only the patient, but the clinical care team, when they have escalated their activity and how that impacted the pain and the swelling. So it's been interesting to see how our clinicians and patients are utilizing this objective data to determine maybe the patient just escalated their activity too quickly, or based on those subjective complaints, they can tell based on activity logs, maybe the patient is just sitting too much in their recliner. So it really changes the dynamic in that conversation and really can put some guardrails around for those metrics for the patients. Instead of saying, take it easy or do more, you can provide objective insights into their activity levels with those step counts. We couldn't be more excited about the possibilities of this platform. I'm going to turn it back over to Chase to wrap us up.
All right, so this is our last slide. I would encourage y'all, please ask us some questions. We'd love to get some back and forth going. And I've just got a little bit more content left. Look, we're in a new frontier right now that we're all living in. My belief system, and I hope you can hear from my passion because it's very sincere, is that the purpose of this call, of what we're doing here at Doc SF, this is the greatest space for disruption in the industry of orthopedics. If I go back to the mission of Zimmer Biomet and our intent, we want to solve problems that have been out there for a long time. But along the way in creating technology, we want to be able to do it in a manner that creates engagement in a personal way. Last piece, I'm going to turn it over to the Q&A, but I want to aim your attention to the middle of the screen where it says trusted partner in blue. Zimmer Biomet, whether Zimmer Biomet that came together, they've been around for decades. We're going to be around for decades to come. We're investing heavily right now in this space of care management, in the spirit of anchoring in our partnership for generations to come. Our goal here is to truly be a trusted partner with you. And I hope you can see that from our presentation today. And that's it. That's our talk. I would like to see if there's any questions that are coming in. And while we wait, we do have a couple of common questions that come up in FAQ that Michelle and I are just going to go back and forth and address and see if that drives any more questions up. One of the common ones that we hear is, does this only work with Apple? The answer is no, it does not. It works with Apple as well as Android. Another question is, do you have to only use Zimmer Biomet implants? This was an intentional choice, and we chose to be agnostic because we wanted to be able to scale this platform to the world. Michelle, if you can help me with a couple of these.
Sure thing.
Yeah, how tech savvy do you have to be?
That's a common question that we get asked, because the impression that many people have is that digital health it's technical and it's difficult. What we have found is that if somebody can work a smartphone, it is very easy for them to work MyMobility. And that has been proven based on our patients' experience and what they are telling us with usage.
Okay, great, thank you. What about the implementation process? How do we operationalize MyMobility with Apple Watch?
Sure, that's a great question. What we have found is that we have a team of operational experts. They work hand in hand with our customers, providing them with tools and processes and best practice as to how we can support them with customizing their content and ensuring that their patients will have access to the tool in a timely manner. It doesn't take long for us to do it. We just need commitment from our customers, and that typically happens to allow us to support them with a quick time to go live.
Okay, great. I'm going to put you on the spot here because this is one we did not plan for. So get ready. When we think about sites that are successful, what are some of those keys to success?
I would say that what we have learned so far with those who have been successful, there's a few things that we have found that are consistent. One is that they see the great value that MyMobility can provide to drive change in their community and in their program themselves. So they utilize MyMobility as a way to create programmatic consistency and a way in which they can differentiate their own program. So they know that this is something different. It will support their patients in a unique way. Drive efficiency is our desire at the practice, so they have less calls, and also support them with creating a marketing approach to say, we do things differently here. We care for you outside of the surgical event, and we care for you outside of the OR. We want to make sure that you create the optimal recovery period through our connectivity. They have to be committed to supporting us. Yes.
Yeah, that's great. Thank you. I'm going to take the last question that we have in our FAQ section. But what do we do next? If there's something here that invoked curiosity or interest, where do you go? Really, there's going to be two avenues. One, I would highly recommend that you reach out to your Zimmer Biomet rep. They're a great source of truth, and they can direct you to a MyMobility specialist. We're more than happy to set up a hands-on demo that gets more granular than what you saw today. In addition to that, if you have any questions or if you just want to reach directly out, please contact me. My email is chase.idleman, IDLEMAN, @zimmerbiomet.com, and we can direct the conversation accordingly. So with that, I don't see any questions coming in. Here's just my final thoughts. We appreciate everybody spending some time today. We need partners in this journey. We believe in the data. We believe in the platform. And we believe that is going to help the greater society. Please connect us. We're here to build those trusted partnerships. Thank everybody for